Hey everyone, so today I'm here to talk a little bit about CBT. So, what is CBT? So, CBT is a structured, time limited, goal oriented form of psychotherapy that focuses on the relationship between thoughts, feelings, and behaviors. CBT also helps clients identify and challenge dysfunctional thoughts and beliefs, which lead to changes in behavior and emotional regulation. CBT focuses on changing unhelpful cognitive distortions and behaviors while improving emotional regulation and developing personal coping strategies. It is also evidence based and is widely used for a variety of psychological disorders. One good thing to remember that is that CBT is short-term therapy, which can lead to long-term benefits by teaching clients to become their own therapists, helping them maintain and progress after their therapy ends. So, a little bit about the history and development of CBT. The origins are that it was developed in the 1960s by Beck and Ellis. And then Beck also observed that the patients had streams of negative thoughts that seemed to arise spontaneously. The evolution of CBT. From the work of Beck's cognitive therapy and Ellis's REBT, CBT has evolved to include various approaches and techniques, such as the dialect behavior therapy, also known as DBT, and then ACT, which is acceptance and commitment therapy. So, something to remember is that Beck's research in the 1960s found that depression associated with negative thoughts and Ellis's REBT focuses on identifying irrational beliefs, replacing them with rational thoughts. The historical connections, order and connections. I thought this was interesting to kind of give a brief timeline. So, in the late 19th century to early 20th century, psychotherapy was founded or created, which is also the origin of all modern therapies because it emphasizes talk therapy and therapeutic relationships and emotional exploration. And then cognitive behavioral therapy, CBT, was founded in the 1960s, and it is obviously a structured, goal oriented therapy focusing on thoughts and behaviors, which become the foundation for many therapies later on, which you'll see in a minute. And then motivational interviewing, that was founded in 1980s, and this explores a client-centered approach that emerged to address ambivalence about change in substance abuse, which influences CBT and other therapies that emphasize collaboration. And then EMDR was founded in the 1980s to early 1990s, and that is a trauma specific therapy integrating cognitive, body based, and processing techniques to reprocess traumatic memories. And then in the late 1980s to early 1990s, DBT was founded, and that is an adaptation actually of CBT. And it integrates the acceptance and emotional regulation and the mindfulness for complex emotional issues. And then finally, in the late 1990s, ACT, or Acceptance and Commitment Therapy, was created or founded. And this is a behavioral therapy that it was also influenced by CBT and DBT. And it focuses on acceptance and value based actions rather than the cognitive changes alone. And then we have some core principles of CBT. So, one of the core principles of CBT is the cognitive model, and that just means that our thoughts influence our emotions and behaviors. And by changing these maladaptive thoughts, we can change how we feel and act. And then there's a behavioral component. So this focuses on changing the maladaptive behaviors to improve emotional responses. So some of these techniques can include exposure activity scheduling and skills training. And both of these things kind of emphasize the presence and problem solving orientation. And then there is a collaborative effort between the therapist and the client, which is important. Some key terms and concepts. So, automatic thoughts, they are spontaneous, often unchallenged. Um, to specific stimuli. And then, so an example, of that is I'm going to fail this exam. It's kind of like an automatic thought that some people may have. So any kind of thought that's kind of like a, yeah. And then cognitive distortions. So that is rational thought patterns. They are also habitual errors in thinking. So this could mean catastrophizing, or black and white thinking, or overgeneralization. This cognitive disorder also recognizes and challenges these distortions, which is a key part of CBT. And then core beliefs are the foundational beliefs about oneself and the world. So an example might be, I am unlovable, or the world is a dangerous place. And then fundamental techniques. So cognitive restructuring. It involves identifying and challenging and changing negative thoughts. A technique for this might include the Socratic questioning or thought records. Behavioral activation is encouraging engagement in meaningful activities to combat depression. So, this is something like involves planning or engaging in activities that bring enjoyment to oneself or a sense of accomplishment that someone may feel. And it helps clients also overcome avoidance or inactivity that they may be having or not having in that situation. Another one is exposure therapy. So exposure therapy is gradual exposure to feared situations to reduce one's anxiety. So this is primarily used for anxiety disorders or phobias or PTSD. And then here we have some different like symptoms, or like depression, generalized anxiety disorder, panic disorder, or social anxiety disorder. So basically different disorders. And why is CBT effective for depression, say? So it's effective because it addresses the negative thoughts or and cognitive distortions while encouraging engagement in positive activities. And so, like I said previously, this can be used, thought records could be used, or cognitive restructuring, or behavioral activation. And then in generalized anxiety disorder, CBT is effective because it challenges excessive worry and teaches coping skills for managing the stress. So some techniques used in that are mindfulness, cognitive restructuring, relaxation, or worry logs, like writing journals, and you can write down your worries. And then panic disorder, why is CBT effective? It helps reduce panic attacks by addressing fearful thoughts and avoiding avoidance behaviors. And some techniques used in the panic disorder is interoceptive exposure or cognitive restructuring. And then for social anxiety disorder, why CBT effective? Because it challenges the social fears and negative self-beliefs while using exposure to build self-confidence in the feared situations. And then some techniques used for that are cognitive restructuring and exposure exercises. So, yeah. Now I will hand it over to Professor Veit, and